Welcome back to Wellness Wisdom. Today we're going to be talking about hormones and how we can impact them with lifestyle interventions like exercise, nutrition, sleep. So first of all, why do we care about hormones? Hormones are essentially signals that our body uses to communicate a need for change. And the best way to illustrate this is homeostasis. So when we do something like exercise, we break down muscle tissue. When we lift heavy weights, our muscles break down. And one way our body responds to this is through the endocrine system. The endocrine system is based on hormones using receptors on and inside the cells to communicate a need for change. And this is how we adapt. So this is how we address stress. And the best way to illustrate this is general adaptation syndrome, GAS. So this is basically alarm phase, resistance phase, and exhaustion phase. These are the three stages that your body will use the adrenal gland, which is a little gland that sits on top of your renal or your kidney, and it releases hormones. So when stress disturbs the body, it stimulates an adaptation. So in the alarm phase, you get those release of like epinephrine, norepinephrine, increase your heart rate, run away from the jaguar. Evolutionarily, that's what would need to happen. The next phase is the resistance phase. So that's where we can adapt if we have proper nutrition. So like when we work out, we enter the resistance phase, we release hormones to adapt. Like the training adaptation would be hypertrophy, which is where hormones that are anabolic or they build tissue. Catabolic would be destroying tissue. We release anabolic hormones like testosterone. And so sports scientists use these principles to progressively overload activity to control adaptation over time. So too much stress with no recovery or proper nutrition would lead to overtraining and injury. That's because too much stress would cause exhaustion, which is the last phase of the general adaptation syndrome. And exhaustion, you can think about being correlated with cortisol, and too much stress over a long period of time without recovery would cause the breakdown without the rebuilding or the anabolic rebuilding of that muscle tissue. So training variables like intensity, sets, which is how many times we'll repeat an exercise, rest, exercise selection, and like overall volume can all be things we can change to modulate that hormone response of our body. And then muscle as the target tissue, we discussed when we exercise, muscle is damaged. And when I say damaged, it's torn. You can think about, like the proteins are torn. Inflammation happens, which is just signaling to the body that it needs to be repaired. And hormone interactions within the muscle fibers stimulate the growth for repair. And so anabolic hormones could be like insulin, testosterone, and growth hormone. And these block catabolic effects from cortisol and progesterone, which function to break down the tissue. Catabolic hormones are not all bad. There's a reason we have them. And the reason your body would release catabolic hormones is so that we can break down tissues to provide immediate stores of energy in the blood. And these hormones block the building of tissue because they're released with stress. So that first phase of the gas, so the alarm stage, that would happen when we're running away from a stressor, like someone with a knife or something. We need to release energy into the blood. We don't really care about the long-term effects if we break down some organ or some muscle tissue. We just need that energy quick. We need to get away from the stress so we can survive and adapt later. So some hormone basics. The lock and key theory states that there is one hormone for one receptor. And this is not necessarily true because you can have partial interactions with other molecules, but you can think about a hormone cannot affect the body without attaching to a receptor and then causing a stimulus as a result. So hormones can only affect if there's a target receptor on that tissue. Receptors can be found on the cell membrane, so on the outside of the cell, which is activated by like polypeptide hormones, or inside the cell, which is bound by like testosterone or steroid or thyroid hormones. So that's just one thing you should think about, is that the circulating hormones in the blood concentration doesn't necessarily correlate with a change in the body unless that hormone can get to a receptor, because that's the only way there's going to be a change. Downregulation is the inability of a hormone to interact with a receptor due to decreased sensitivity or removal of those binding sites or those receptors. So this you can think about is if muscle tissue is stimulated to grow by a hormone, introduction of more of that hormone will yield like diminishing returns because there's less sensitivity over time and fewer binding sites. So the same kind of thing happens with diabetes 2, which is where insulin has a decreased response because the individual has so much glucose over such a long period of time. The receptor to take that glucose into the cell is downregulated, so it's less sensitive, so that insulin's effect has a diminishing response to that stimulus. Upregulation is the exact opposite. So with a stressor such as exercise, or sensitivity and receptor number can actually increase as a result. So when we exercise, we adapt more receptors, so we become more sensitive to testosterone, because our body says, oh, well, if we're going to be progressively overloading with weights or volume, then we might as well start adapting to the stimulus, so we have more receptors to bind on those muscle tissue cells. So there are many types of hormones. The first one we'll discuss is steroid hormones. Steroid just means like it's fat soluble, so it can pass through the cell membrane to act on a receptor inside of the cell. And inside, the hormone binds to a receptor to form a hormone receptor complex, HRC, and this can stimulate the nucleus of the cell, which houses the genetic information that codes for things like protein. It creates an mRNA strand, and that this mRNA is just like a copy of your DNA, and that message is going to be sent to your ribosome, which codes for proteins. So to simplify that, hormone goes into the cell codes for new protein to use like for anything. That's how anything happens in your body, is through that DNA transcription. And this is how a hormone changes the body's actual composition. One steroid hormone we'll discuss is cortisol. Cortisol is considered catabolic because it is released from the adrenal cortex in response to stress, and it signals for like carbohydrate metabolism and controls glycogen inside of the muscle. And it's released, as I said, when we need immediate energy. So if glycogen is low, proteins will be catabolized. So that means proteins will be broken down to produce energy to maintain that level of blood glucose so that we can think and run and sprint away from stressors. So this causes the inhibition of protein synthesis and suppression of the immune system, because if you are in a fight or flight response, it's not necessarily life or death to fight off a flu, whereas it might be life or death to escape from a crocodile. So it's important to look at cortisol as healthy, because stress can sometimes be healthy, but we need to think about how we can maximize anabolism and minimize catabolism, and cortisol is just one way we can do that. So cortisol is actually higher in the earliest in the day and decreases throughout the day. So your circadian rhythm is actually really important here. So that's why scientists would tell you that you should have a regular sleep schedule, sleep 7 to 9 hours, and wake up and go to sleep at the same time, so cortisol can be consistent. So cortisol can also be released with exercise, and it's not all bad. So like increases in short-term acute releases of cortisol in response to that inflammation inside of the muscle we were talking about can contribute to some remodeling of the muscle. So this says like if you break down your muscle tissue, a little bit of cortisol might be good, because when you train, you damage muscle, and cortisol may actually clean away those damaged fibers and prepare for like a clean slate of new proteins, though that's not something I'm 100% on, but it kind of makes sense. But long-term cortisol release, we know, can be detrimental. It can inhibit anabolic effects of like testosterone and growth hormone. So high volume, short rest results in the most increased cortisol, because that's the most stressful on the body in terms of exercise. And chronic cortisol, which means cortisol that's released day after day. You're stressed, you drink alcohol, you do all the things that stress your body. You're going to release a lot of cortisol over time. That's going to cause catabolic effects. And it can even cause things like Cushing's syndrome, which we'll discuss a little bit later. But that's just like cardiovascular things and other harmful physiological effects that can happen as a result of long-term cortisol. So testosterone we like to see as the savior of bodybuilders, and it's kind of true that it is an anabolic hormone, so it can promote the building of protein. It does a lot of other things, but we'll discuss the anabolic effects today. So circulating testosterone also means nothing unless there's a hormone. That hormone can find a receptor. So resting levels, as I said, will not be a direct marker of anabolism, but it can be it could be correlated with motor unit activation. So with mechanical resistance, we activate motor units. So motor unit activation, metabolic demand on the tissues, and it can correlate to receptor binding, although it's not like a one-to-one linear relationship. So testosterone can actually stimulate growth hormone from the pituitary gland, and this is kind of like a double whammy, because growth hormone is incredibly important for protein synthesis. So growth hormone might actually aid testosterone's anabolic impact, because they kind of work together in that way. Testosterone can also bind to neuronal receptors. Neurons have these junctions that release neurotransmitters, that release like norepinephrine, acetylcholine, and they increase force production. So that's really good. So how can we adapt to get more testosterone with our training? So high intensity interval training, you would think it's very catabolic, which it is, but testosterone is also released as kind of to combat that catabolic effect. So what is high intensity interval training? It's just repeated high intensity exercise bouts with brief recovery periods. And as I said, like that's the kind of structure that maximizes catabolic effects, but testosterone will also be released to combat the catabolic effects. So one example would be like a 2-minute run at 95% of your VO2 max, with a 2-minute walk, jog recovery. Repeat that for like 6 to 8 repetitions. That would be a high intensity interval training workout. Testosterone can minimize the breakdown of tissue, and it can kind of flag for like, hey, let's preserve this muscle. So oxidative stress from that HIIT interval training is actually important, because it's going to decrease the muscle fiber size, and you think that's a bad thing, but when you're training for oxygen transport into the cell, that surface area gets larger compared to the volume of the cell. So that's just one of the responses of that training. But HIIT interval training is good for many things, especially if you're detrained. You can also build muscle with that form of training. But the traditional way we think about testosterone response is with good old resistance training. So we can think about how to maximize testosterone starting with large multi-joint. So that's using like your legs, your hip, your ankles, a lot of different joints, compound movements. So those are movements that require more than one muscle, like almost all of the muscles in your body. So those are things like deadlifts, squats, power cleans, huge, gigantic lifts, and this is at a heavier resistance of like 85 to 95% of your 1 rep max, and the volume should be pretty high. So for example, 6 sets of 10 repetitions at 80% of your 1 rep max is a lot of volume at a lot of intensity, and so that's going to be sufficient to stimulate the release of testosterone, because we're flagging the body like, hey, we need to adapt to this stimulus so we can perform better next time. So short rest intervals of 30-second to 1 minute is pretty short. Like I would say, you would want to rest as long as you need to do it correctly, especially that intensity. But that they said that was maximizing that testosterone release. And then 2 or more years of resistance training experience can also just increase the release of testosterone. So I guess when you upregulate the testosterone production and sensitivity for the long term, you just get more returns. So testosterone can also adapt the nervous system, as I said, in the long term. So this will improve strength and power. Testosterone demographics, so younger men below 30 years old had higher free testosterone after a workout than older men. Also, testosterone in women is 15 to 20 times less than in men. However, a small but significant increase in testosterone could be found with women after 6 sets of a 10 rep squat workout, which is a lot of volume. So those are just the top contour of testosterone anabolic hormones, and we'll move from steroid hormones to polypeptide hormones. So these are basically just hormones that are made of many amino acids, so many amino acids. So polypeptides are not fat soluble, and this just means that the cell membrane will have to bind on the outside of that. We can't go in through it, so that's pretty much the best or the top contour of that polypeptide hormone. It cannot go through that membrane, so we have to bind to the surface of the cell and use a secondary messenger to go from the surface of the cell to the inside of the cell to have to communicate an effect. And so insulin binds a receptor on the outside of the cell, and this causes a messenger, the GLUT4 transporter, to move from inside of the cell to the outside of the cell, and that allows for glucose or sugar to go from the blood into the cell. And insulin is considered anabolic because it preserves protein, and it wants to take in glucose. But that's all I'll really say about insulin. Growth hormone is also polypeptide hormone, and this is the big one we'll talk about because it's difficult to determine a direct cause and effect relationship with the growth hormone because it does so many things and it has many chemical structures, which makes it difficult to pin down. However, there is a very positive correlation between growth hormone response in muscle fiber hypertrophy following 20 weeks of resistance training. So we know it's anabolic. We know there's many different forms of growth hormone, but we'll try to keep it general and easy to understand. So growth hormone functions. It decreases glucose use and glycogen creation, so it's anabolic. It increases amino acid transport, protein, cartilage, and collagen creation, synthesis. So that just means that these anabolic properties make growth hormone important for tissue healing, growth, and recovery. It also increases fatty acids, amino acids, and glucose availability for the tissue to use to build. So growth hormone results in those conditions where tissue repair and exercises can break down the tissues, and then tissue repair can occur due to growth hormone signaling for repair. So this is why sleep is so important, because growth hormone is released when we sleep, and this is not how we recover when we recover most when we sleep. It's because of growth hormone. So that's because cortisol is lowest and growth hormone is highest, so that causes a net anabolic or tissue building environment, which is kind of cool. But growth hormone can also respond to stress, which is something interesting. So like when you hold your breath or you hyperventilate, that stress is that stress releases growth hormone. However, a intensity threshold must be reached to actually release that growth hormone. So for exercise, this means that a load which is too light will not actually stimulate that growth hormone, because your body's smart. It's not gonna do things it doesn't need to do unless you stimulate it sufficiently. So high loads, long durations, low rest periods is sufficient for glucose release. So like a 1 minute rest period between 3 sets of 10 reps at a fairly high intensity had a good growth hormone response. And growth hormone also stimulates the liver to release IGF-1, which is insulin-like growth factors, or somatomedins. So thyroid hormone and testosterone also increase this IGF. And why this is important, it's anabolic. IGF-1 travels in the blood. It binds with receptors. Nutrition and exercise have been shown to regulate insulin growth factor. So it's important that we control these variables so that we can get the most anabolic environment possible. So pre-workout carbohydrates and protein intake was correlated with a higher IGF-1 release with exercise. And I'm hypothesizing that a caloric restriction might blunt that IGF-1 release and cause a more catabolic environment. Because if you're not, if you don't eat the fuel and that fuel's not circulating in your blood, you're going to have to release things like cortisol so that you can mobilize your existing energy stores for use while you're exercising, which is a catabolic environment. So as at rest, IGF-1 is stored in fat cells with little in skeletal muscle cells. However, with mechanical stimulation of muscle cells with resistance exercise, muscle releases IGF-1, creates a more anabolic environment. So moving on to amines, amine hormones, they're synthesized from the amino acid tyrosine. And the big ones we'll talk about is catecholamines, epinephrine, and norepinephrine. So these are the alarm stage fight or flight hormones. They stimulate your sympathetic nervous system, which is like, hey, we got to increase our heart rate, we got to increase our blood flow from the heart, we got to mobilize glucose in the blood, we got to improve calcium release in the muscle to improve strength and power. We got to improve muscle blood flow, which will move glucose to the blood, which will move sugar to the muscle for activation, fuel. All of these things will improve our ability to produce force, to escape, to chase, to fight. So that's kind of amine hormone, catecholamine, and that's just like a stress response. Catecholamines in exercise, it's actually good for exercise because of those things I said. You want to have a high cardiac output, especially when you're like sprinting or you're producing strength and power in an event or a sport. So like 3 sets of 10 repetitions at high intensity with 60-second rest was shown to increase catecholamines. And with resistance training, we can actually release epinephrine more during a max effort. So it improves with training. But long-term stress can cause renal exhaustion. And what that means is catecholamines can be depleted. So long-term cortisol can contribute to this Cushing syndrome, which we talked about earlier. It's really just a cluster of symptoms like cardiovascular disease and osteoporosis, because when you're chronically asking your body to be stressed, so you're releasing a lot of catecholamines, a lot of cortisol, you're going to run yourself very thin if you don't properly fuel your body with good nutrition and then rest when you're supposed to rest. So exercise and hormones. Moving on to just general concepts. Hormones play a large part in growing size, power, and strength. We know this. So when we exercise, it's also psychological. So hormones are released pre-exercise due to psychological anticipation. So that's really cool. because we know that it's not just one factor. It's your brain, it's your body, it's your what you're putting into your body, how are you recovering, it's your psychology, but it's also mechanical stress. So when large motor units are recruited, the sensitivity and number of receptors changes to those anabolic hormones. It's been found that 1 to 2 heavy resistance sessions can increase androgen receptors inside of that muscle. And that just means that we get more sensitivity as we train, so that testosterone will have an increased effect from training. And that hormone responses will depend on the amount of tissue stimulated, which means pretty much more muscle stimulation will cause a higher hormonal response. And repeated stimulus of hormones will desensitize the receptors after a genetic limit is reached. And so this is when we see people training for many years, and they do the same thing. They simulate the same body part with the same resistance. That muscle cell will just not be stimulated to grow any longer because there's a genetic size potential, especially with the same stimulus. So we need to mix things up. We need to change our training. We need to optimize our training if that's our goal. Dosing exercise is important because a catabolic effect obviously occurs with overtraining. Hormones in the blood. Hormones can be released into the cells and blood with exercise. However, we know that it's not a one-to-one marker of cell change because of sensitivity. So if there's a decrease in hormone concentration in the blood, it can be due to higher uptake into the tissue receptor, which means it's having an outsized effect. If you look at your blood and you're like, wow, there's no testosterone in there, it could just all be bound to your cells actively, and you would just not have it in your blood sample. So this means it's anabolic or catabolic environment cannot be examined completely with the blood sample, although it can correlate. So we can adapt our endocrine system. So when one exercises, endocrine system can be trained, it can adapt. The size of glands can physically change. The creation and storage of hormones can change. Receptor sensitivity can change. So that is to say, you can change your physiology for your goal. You just have to know what your goal is. So to wrap things up, I'd like to go through some takeaways that you can take with you. So train with large compound movements to grow. This is because the more muscle fibers involved in exercise, the greater the stimulus. This is the principle of specificity, meaning only resisted muscle will adapt. So we should perform many multi-joint compound movements for high intensity for many sets with short rest periods. 30-60 seconds has been found to be most effective. However, take a rest that's sufficient so they can safely perform the movement. And growth hormone can be increased through 10 rep max heavy resistance for 3 sets, or with the use of short rest periods. In pre-exercise nutrition, carbohydrates and protein, as I said, and after workouts will improve growth hormone release. Adrenal hormone can be optimized with high volume, large muscle groups, short rest periods, and you need to allow for complete rest in order to replenish those adrenals so you can prevent long-term exhaustion and stay sustainable. And lower volume workouts can be worked in to allow those adrenal glands to engage in active recovery. We don't have to be going 7 days a week, just crazy workouts every single day, because that's going to lead to overtraining. So anabolic and catabolic balance, as I said, cortisol and testosterone and insulin, these all kind of mix together and compete for whether the internal environment is going to be anabolic or catabolic. And with our actions, we can actually have a vote to which environment we can create. So sleeping 7 to 9 hours, waking up and going to sleep at the same time. This is going to decrease cortisol, increase growth hormone. We're voting for an anabolic environment. We're going to perform resistance training. We're going to stimulate testosterone release, and then we're going to upregulate the sensitivity of our receptors. We're going to minimize that stress, decrease the catabolic effect of cortisol. We're going to eat sufficient calories and protein. So we're going to ingest carbohydrates and protein pre-workout to improve the androgen response, the release of hormones that we want. If you already have the nutrients in the blood ready to be used, you don't need to release as much catabolic hormones to break down energy stores. And for nutrition, 1 gram of protein per pound of body weight is what I would recommend, so that you can maintain protein to build more muscle. So protein is actually anti-catabolic. So if you eat sufficient protein, you won't have to break down as much protein because it's just circulating in your blood. You won't have to break down your muscle tissue. You can just pull from your blood for protein. So minimize catabolic drugs like alcohol and other behaviors that will stress you out in the long run. So this was about hormones and how we can optimize them with exercise. So if you learned something, hope you enjoyed it, and I'll see you on the next one. Peace.